And again, I'll go to these international conferences and I'll see these top expert plastic surgeon injectors state that this is the best way to inject a temple. And I'm thinking, that's the best way to cause blindness and congest the lymphatics. There is a better way. Let me show you how. What's up everyone, Dan Julian here, nurse practitioner for Dan Aesthetics Medical. Today, a very special edition for you because we're doing two things at once. First of all, I'm giving you my favorite entry points when using a cannula, restoring temples, forehead, and the neck. And on top of that, for the temple, this is a brand new technique. I'm sharing with you an advanced technique for restoring temples in the right way. This is going to be safe, effective, it's not going to congest lymphatics, it's going to give you the best bang for your buck, and it only has one entry point. You're going to absolutely love it. Stay tuned, let's get into it. So let's review my rationales for the entry points. Number one, is this a safe entry point? Am I running parallel with any major arteries, or am I going perpendicular? I always want to go perpendicular when possible. Number two, is this going to provide me with aesthetically pleasing results right away? And am I comfortable in this position here? Is this ergonomically good for me? And number three, is this product going to stay there, or in 2 weeks, is there a good chance that it's going to migrate somewhere else, or it's going to provide some other unwanted side effect? So those are the three things that I'm looking for, and here we go. All right, guys, let's start off with doing the neck. There are two different techniques that I've learned. I like both of them, to be honest. Both of them are safe. They provide me with great results and ergonomically puts me in a good position and the product's not gonna move anywhere. I'm gonna show you these two techniques and I'll just let you guys choose which one's best for you. Test them out yourself. I now use the midline technique, but both are very good. So let's get right into it. Let's bring in Sarah. Well, let's look at her neck. So we have neck, we have necklace lines, or these tech neck lines. And they're important here whenever I want to address these two techniques because one will address these better than the others. Okay, so the first technique is a 3-point technique using a position right here. That's your entrance point. Notice that they're all green here because these are all good techniques to use. And you're just going to basically go right medial of the sternocleidomastoid muscle, SCM, right here. And you're going to go in the midpoint between here and here. And the reason why this is great is because if you're using a long cannula, you can reach basically all across here and you're going to get a good job. So that's one entrance point. Do the same thing over here, right here. And you're going to do the same thing. You're going to coat all the way over here, and that's really nice. Now when it comes to the submental region, which is all here, you're going to make your entrance point just underneath the chin, right here. And then you're going to take your cannula and you're going to coat, again, superficially, subdermally, all there, and you're basically covering everything, and you get a really nice outcome with 3 injection points, and clients are very happy. As long as you're staying superficial, you're not going to have an issue. Your 2 major arteries are going to be your carotids that run here and here, but remember, those are deep. You're running perpendicular and superficial. You should be fine. The other way to treat that, which I learned maybe a couple years ago, and I do enjoy it, is the midline technique right here. And basically what you're going to do is place your injection points directly in the middle. Same one, just underneath the chin for the submental region, but instead of starting over here, start in the midline. The bonus of the midline is that you can reach all areas here, turn your cannula around, do the same thing over here, but the real benefit are these necklines. Whenever you're placing your entrance point at the necklines, you can go directly underneath them and you can prop them up, improving the necklines at the same time. It's a really nice bonus. Ergonomically, it works really well. You do have to kind of like go around the client a couple times, but I really do like that technique. Both of them are very good. I give them all thumbs up. Choose one that's best for you. But remember, if you're looking for advanced techniques like that, make sure you have a little bit of education and a background and a provider that can teach you what to do. All right, next up, the forehead. Let's bring in Sarah again. Let's fix her hair because Michelle's going to kill me. We have the temple crest, and then after that, we have the supratrochlear arteries and the supraorbital arteries. And what do we notice? They all run north. So the last thing you want to do is inject parallel with them. But I do see that sometimes. People come in here and kind of inject this way, and I've even seen one person mention that you just place your cannula here and you can kind of do all that. For me, that's like playing with fire. I do not want to do that. So what I'll do is I'll actually place my entrance point right here. The real nice thing about doing the entrance point here too is that most of the time people usually have a hollowing right across here. And this entrance point is going to give me direct access to that. So make sure you inject deep here. So when you're placing your introducer, make sure it's deep. You want to be underneath the galea. So you have skin, superficial fat pad, muscle, galea, and then a smooth gliding plane, which is just on the bone. You want to be in that gliding plane. If you place your cannula in here, you shouldn't be able to tent it up. If you can tent it up easily, then you're in the subcutaneous plane. And the problem with that is that you're going to block some of their movement. Not only that, whenever they do move, you're going to see a bulge of the product. Place it underneath. Everything looks great. Doesn't matter the age. You'll love it, and it's much safer. So right here and here, stay deep. You'll love it. Last but not least, the temple. Let's bring in Stuart. What's going on, Stuart? We have a lot of things going on and to explain, so let's get right into it. First of all, I want to highlight that this is his hairline, the brown here, and then we have three major arteries. We have the superficial temporal artery, which usually runs along the hairline. You can usually palpate it, you'll feel the pulse, and it connects or anastomoses with the supratrochlear artery that can lead to the eye. So you definitely need to avoid this guy. And then you also have two deep temporal arteries that run around here somewhere. One's posterior, one's a little bit more anterior. But you definitely want to avoid all of them, right? So how are you going to do that? Don't inject parallel with them. Now let's get into the techniques that I've learned and why I prefer using a newer technique. Now, when it comes to restoring the temple, the best bang for your buck is always restoring the deep temporal fat pad, which is also known as the interfascial technique. And by the way, that deep temporal fat pad is an extension of the buccal fat that starts here, goes underneath the zygoma, and continues there. You want to restore that because it looks the most natural and it's not going to congest all your lymphatics compared to maybe coating the superficial fat pad there. So let's look at the anatomy. You essentially want to be in the fourth layer. The layers are skin, superficial fat pad, the fascia, then just underneath that is your buccal fat or the deep temporal fat pad. And that's where you want to be. And the way you know you're there is by hearing two pops. I know you guys don't like hearing that, but that's the way it is. So this is how I was taught. This is the interfascial technique, okay, where you have to go 1 centimeter below the temporal crest because this area is too tight of a space for that cannula to pierce through both layers. You got to get a little lower. And then after that, you can make your entrance point. And then after that, you're going to place your product like this. Well, obviously, you know I don't like that. Look at this. I'm going parallel with all these major arteries. And even if I'm using a 22 gauge cannula, it's super dangerous. Cannulas, even 22 gauge cannulas can cannulate an artery. So for me, I don't love that. The other thing too is that I'm going to definitely need to make another entrance point somewhere else to reach all this area that I'm missing. Because often enough, this area needs to be restored as well. So this means that the interfascial technique by coming here is a little bit more dangerous and you have no choice but to create another entrance point somewhere around here in order to cover everywhere else. Now, because that technique is so tricky and it doesn't provide optimal results, a lot of providers are going to do a combination of these two techniques. The one up and one over, which is done with the needle technique right here. And then after that, they go to a cannula and they're going to coat superficially in the superficial fat pad right here. The problem with those two techniques are one, whenever you're doing the one up and over, this is an actually pretty dangerous way to inject. Often enough, there's an artery here. I have an ultrasound. I was told that this is an avascular region, but I'm telling you, over 30% of my patients, whenever I do an ultrasound here, have an artery and it's on bone. So I do not do that one up, one over technique. I think it's a little too risky for me, even if I'm aspirating. The next concern is starting over here and placing the rest of the product superficially. The problem with that is now you're congesting all the lymphatics because all your lymphatics here run superficially. And then on top of that, your veins are going to throb for a good 2 weeks, maybe even longer because they're absorbing all the lidocaine and you're congesting all of them with all of that filler. So what else can we do? Well, let's get into this new technique. So let's bring in Stuart and show you the new technique. Okay, so basically what you're going to do is you're going to make your entrance point right here at the same location as your superficial fat pad filling technique here. However, the temporalis muscles, fibers all move this way. They all swoop that way. So by moving this way, remember, you're going with the grain. So it's actually going to be easier for you to get deep here. So your first entrance point is going to be here, but what you're going to do is feel two pops. First pop through the subcutaneous, second pop through the fascia, and now you're into the deep temporal fat pad, and that's where you want to be. And you're going to coat all of this area with the product deep. Right here, all of this area, 90% of your filling is going to be done in the deep temporal fat pad. Then once that's done, you're going to retract your cannula and you're going to go more superficially. And now you're going to be into the superficial fat pad. And all you're going to do is you're going to restore any areas over here that are really tight around the orbital rim and the temporal crest right here. And that's going to tie it off perfectly. So you're saving a little bit of product for around those tight spaces, but that means 90% of your product is going into where you want it to be, in that deep temporal fat pad. It's also perpendicular to your arteries, and it's a much safer way to inject. I've tried this out recently and it is terrific. I highly recommend trying it out. By the way, if you're a provider and you'd like to see these techniques in real life, check out my Patreon. Or if you want to grow your business to $1 million plus, check out my school platform. Both are below in the link. Enjoy. So I hope you guys enjoyed this video. And by the way, I didn't create or invent most of these techniques. These are things that other providers have been doing. I've tried and tested various techniques, and I'm just giving you what works best for me. I hope it works for you. Until the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Cheers.